got started, and then we are going to be together. If you can't be able to hear me, there's no one that can be able to hear me. There's one person that is connecting. Maybe we can give them 1 minute and then we can get started. So I got introduced to this company by a very close friend of mine that we are working with. And for me, she came and told me about a business that we can do and we make lots and lots of money. And at that particular time, let me connect my battery. And that, sorry for that. Just give me 1 minute. I'm experiencing a technical hitch. 1 minute. Okay, sorry, my laptop was going down. Apologies for that. And at that particular time, I didn't see what she wanted to talk to me about because I was busy in my office. But at that time, I was having issues with my pregnancy. I was having what we call preeclampsia, that is BP in pregnancy. And when I came in and she recommended a few products, my BP went down and I was able to have the baby normal delivery. Unlike my firstborn, where I had to go for an emergency CS, I had to go on early maternity leave. So I caught the belief of the product. And when I came back from my maternity leave, I found that my business had not progressed because I was not doing it. I had just partnered with the company to use the product. Then my daughter was diagnosed with asthma at a tender age of 8 months. And I came in and I listened to a training like this one, and they did a few recommendations on the diet and what we should do and what we should not do. And a few months later, went to the doctor and we were off the inhalers and the other strong medication that we were going to be getting every now and then, and we were getting. And also that hospitalization that mostly comes with such conditions. And that's when I developed a passion to do this business. And I decided to take it as a career option. So today I do the business full time as I take care of my young family. I'm married, I have 4 wonderful children. And today I'll not speak a lot about myself because today I'd like to show the guests and other people that are on this call, how do we take charge of our respiratory health? I've been from a family that has issues with their respiratory health. I had bronchitis from a very tender age. Those of us who were born that time, there are those injections that you used to go and get that could last a week. And there is that 5-liter syrup that the doctor or the nurse used to put for us in a bottle. You used to go with your bottle to be put for. And I was a frequent customer of that hospital. And I had issues also with my respiratory system. And for me, I came in, I used to be the person who would sometimes even wheeze, but today those are the things of the past. My other son, who is that born, had allergy of milk, had eczema. And today he no longer has those issues. We hardly go to the hospital. I'm not saying that we are 100% not sometimes get these colds and flus, but if we get, we overcome that very fast. So I'm forever grateful to that friend of mine who persisted to speak to me about my health. So today I'd want us to quickly go and learn about our health, and which I will just share a screen, and then we move from there. So what do we require for us to be healthy? We require 3 things for us to enjoy good health. And we need to rest, we need to exercise, and we need a good diet. And for us to be healthy, I want us to look at rest. Rest is very important because rest is what is able to help us heal our bodies, because our bodies is our health is our greatest wealth. That is what our health entitles, and it is an investment. Without good health, we cannot be able to enjoy what God has blessed us with. And for us to enjoy that wealth is that we need to observe these 3 things. We need to rest, have enough rest, 6 to 8 hours. Make 7 your number, that you sleep for 7 hours. Why? Because when you're resting, our body is able to heal itself, our body is able to relax, and we're also able to get out some stress and also be able to fully function. And also we need to do some exercise. We need to exercise 30 minutes a day. And let's do all forms of exercise. I've discovered that as COVID came, we were immobile for some time. And even to go through the same regime that you used to go to the gym or you used to run as a group, people got discouraged because of COVID. But you can have simple things that you do. I remember you can walk down the stairs and up the stairs. You can also play football with your children. This is currently what I'm doing. And they're the small things, and I felt that they are really helping me. And then the other thing we need to look at is our diet, because diet really determines us. That is what we eat, but nutrition is what our body uses. And before we go much, I'd like us first to look at respiratory health. And we need to have, sometimes we take breathing for granted. When our lungs are healthy, they can easily expand into our chest cavity. We inhale and exhale at the same time. But right now, we actually have valued breathing, because hardly would you find me outside without a mask. And those of us who are wearing glasses, you find that they're actually even forming mist. So for those that have respiratory issues, it's becoming a challenge to wear a mask full time. So it is very important for us to be able to breathe normally. If we lack breathing, that's the end of us after some few minutes. So it's very important. And we have some respiratory challenges. The first one is asthma. This is when it's the airways are inflamed and they are blocked, and they can, somebody can hardly breathe. And sometimes that's why you see people being given inhalers. And for the young children, the inhaler is put into something like that that will cover the mouth, that looks like a mask. My daughter was given that. Then we have things that asthma is very, very common. Very, very common, is one of the chronic diseases that we have. Then we have bronchitis. We have what we call cystic fibrosis. This is a genetic condition that causes the organs that produce the mucus, including the lungs, to become thick and sticky. So, it brings infections and inflammation. And inflammation is when our lungs are inflamed and it is producing that water. It makes the lungs collapse, and also we are unable to breathe, and it causes respiratory failure, which is very bad, because you find that people who have asthma tend to collapse. And also we have what you call pulmonary fibrosis. These are scars that stiffen the lung tissue, and also they restrict the lung movement. We have sarcoidosis, and this is a very rare condition. It comes in different parts of the body, and they are very tiny cells that grow and that constrict the lungs, and somebody cannot be able to breathe very well. Then we also have lung cancer that affects us in multiple ways. You find that people will have tumors in the lungs that will affect the breathing and the movement of the air, and they also collect fluid. around the lungs. That is also inflammation that is not very good, and they will make the respiratory system also collapse. And these tumors, wherever they are removed, they grow faster, and that's lung cancer. We also have infectious conditions. The ones that I've spoken about would hardly pass it from one person to the other. Can be genetic, can be from inherited. Like you find that in our family, we have those respiratory issues, but they can never be transmitted like tuberculosis. We have infectious conditions that can come through a virus or a bacteria. And these are things that affect us. Now, we have pneumonia. Pneumonia comes mostly as a bacteria or a virus, and sometimes it comes and it thrives through the cold season. We also have TB, that is tuberculosis, that affects the lungs and other parts of the body. And it can be an inactive for many years. I remember one of my uncles, I don't know whether you can, if you can't hear me, please let me know so that we move together. TB affected one of my uncles, and he didn't have a cough, he didn't have any infection, and he was unwell for some time, and he was swollen at the back, and the doctors thought that he's having meningitis, only to be discovered that he's having tuberculosis, and he was treated for the 9 months period, and it really affected him. And what you find that the effects of these things are very, very severe sometimes, because the medications will damage our organs, including the reproductive organs, the kidney and the liver. Then we have some certain causes. Smoking is one of the causes. So if you smoke, please stop. And if you find that if somebody is asthmatic and you smoke when they are there, you actually affect them and they are going to lack air. We also have that, it's also a trigger. We also have air pollution. Those are environmental or factors that trigger. Also something like pollen. I remember when my daughter was diagnosed with asthma, I had to do away with teddy bears. I was told to do away with cats. I was told if there are cockroaches in my house, the eggs are very bad for people who are asthmatic. So if there are cockroaches, I was told to make sure that there are no cockroaches. If there was maize that was nearing us or flowers that flower because of pollen or hay, we had to eliminate them. The dust, the bed termites, and these are something that are not seen with the naked eye. And you find that if you are living on the road because of the air pollution, because of the dust, you are advised to move. And also, there are other autoimmune conditions. You find that the body is not able to have proper immune system, and also the body is fighting itself, the other parts of the body, and also we have genetic. But there's something else that causes, really triggers these things, and that is food. You find that some people have food intolerance. Food intolerance. So you find that these people will react. Their bodies are not able to produce what we call the antibodies that are able to make our food metabolize or be digested. So people have those conditions. If people have intolerance of, they can't take milk, the properties in the milk, in the meat, the red meat and the animal product, you find that they are causing eczema. So some of these are the causes. And when you have eczema, most of the time you find that it leads to these other respiratory conditions like asthma. So those are some of the things that you'll find that are affecting us. Now, what are the symptoms? Number one is that the shortness of breath with activity. Also, you can have a persistent cough that is not going, and then you can get a wet cough with mucus. We call it the productive cough. This comes with people who are asthmatic, people who are have other infections, they always have those productive coughs. We also have non-productive cough. That is the one that is not producing the sputum. And COVID is one of the things that is not producing this. When you have it, you're not having that productive cough. Wheezing, you find that you're wheezing. And then even I used to find that when I'm eating, I have to open my mouth after several chewing and all that. And then hoarseness of voice, and we also have recurring respiratory infections and fatigue. These are some of the conditions that we find and
Lydia, did we lose you? Let's give her a few minutes to sort out the connection, please. Lydia, we lost you there. Lydia, unmute.
Can you hear me?
Yeah, we are good. Thank you.
Yeah, good. I'm sorry. Technology has a way of getting us. I'm so sorry for that. I will continue from where we stopped. And so I used to find that my daughter used to have challenges, even having that appetite, because when you're coughing all the time, that uses a lot of your energy. And she had, you could say that she has challenges of body weight because she was not a good eater. And sometimes the sputum used to be so much that if she eats, she's going to throw up because the sputum is trying, it has blocked her feeding pipes, and she would, when she's coughing, she would throw up at the same time. And it is challenging as a mother. So it was a journey that is difficult for us as parents, and even for that person who is unwell. So there are some of the things that I did, but before then, let me finish with sharing the last challenge that we have when it comes to respiratory issues, and this is new to most of us because it came in last year, and this is COVID. COVID is here with us. It's unfortunate. We pray to God that it is going to go, but there are some of these things that we must learn about COVID, and it's becoming acute. As they say, it's an acute respiratory illness in humans, and it is caused by the coronavirus. And this is something that was identified in China in 2019, and it became a pandemic this year. And it is causing deaths and severe challenges, even with the people that are, some of the people that have recovered. It's and it is targeting older people, and especially those with underlying conditions. And my brother, who is a medic, was telling me that mostly it is not children are carriers. It's not putting them down, but they are the ones who are transmitting highly to us. So we also need to protect our children. And it also has its signs, its symptoms. And I know we have a lot of information about COVID, and because of time, I'd not want us to go through that. But I'd like to marry in about the health challenges that we get out there with us, and the solution that we can give you. And we'll start with our story. And Jerry Brasfield is the founder of a company that I partnered with many years ago called Neolife. And Neolife was started in 1958 by Jerry Brasfield. Why? Because he used to suffer from asthma. And every time, especially during the hay season, he used to have attacks. And he says that he remembers that his mother used to be very scared, even calling the pastor of the Christian faith. And she noticed that the mom changed his nutrition and was giving him supplements, and especially vitamins and omegas, and he felt better. And he made it a mission to make the world a healthier and a happier place. We are 62 years and going, and Neolife is in over 50 countries of the world. We're in over 50 countries, and we are in a mission to make the world a healthier and a happier place. Why? Because you find that people are suffering with these issues that are of the respiratory system and other issues. But we have a solution. We have a solution in our lifestyle, in the diet that we are eating, in our environment. We can do something. We do not have to wait for the doctor. The doctor is important. They have their place. Once they do what is important in our health, to diagnose and to treat, we also have that role for us to play, to be able to prevent and to manage this condition. And that is where Neolife is coming in. And one of the key mission of Neolife is to reverse the trends. And there was a prediction that by 2020, chronic diseases will account for every 3 out of every 4 deaths. That is heart disease, cancer, diabetes, stroke, chronic respiratory disease. And these are some of the conditions that we have spoken about, and obesity. And you find that these conditions are killing people today more than HIV and malaria combined. Why? Because the doctors and the government have a way of helping people who have those conditions, creating awareness. But you find that these other conditions that are lifestyle, hardly do they sensitize us on what to do. But at Neolife, we want to reverse these trends. Chronic respiratory conditions are some of the things that they can be a history. It is a history in my house, and it can happen for our loved ones and ourselves at the same time. So number one is that we need to look at our health status. How are we eating? Now, one thing that we have to know is that we have to do physical activity and manage our weight. It is not very good to be physically inactive, even when you have the respiratory conditions. I remember when I used to run, I couldn't go for races, but I ran and cough at the same time. Let me tell you, that's a chest therapy. When my daughter was having that mucus that is just have stuck around her feeding area and her throat, the doctor used to tell me I have to make her run, I have to massage her back, I also have to make her cough often. Why? Because when she coughs, she clears the airwaves. That is number one. Number two is that when she coughs, she's able to remove that mucus, because the water that is in the mucus is what causes the lungs to collapse and causes an attack. So it is very, very good to be able to do exercises even when you have asthma, even when you have bronchitis. You might not run as much as these other people do, but let's do it. Why? Because it is going to help clear the airways. The other thing that we need to do is manage our weight. You find that when we are overweight and we have these conditions, it is not also good. We need to lose that weight. And we also need to increase the weight, because when you're underweight, it's worse. Because I remember when my daughter was having this condition and she was underweight, it was difficult for the doctors even to give some medication, because remember, some medications are given as per the weight of the baby. So we need also to check on that. Then we need to eat good whole grains. We need to eat whole grains at the most. And whole grains is anything that has not been processed. Because when foods are processed, they have sugar. And the sugar is one of the key enemies of respiratory challenges. Then we need to eat a lot of fruits and vegetables, because they are going to boost our immunity. And then we need to eat less of protein. When you have asthma challenges in the house, when you have bronchitis in the house, when you have other respiratory issues and also things like eczema, we need to reduce on the animal protein, because what happens is that it causes inflammation, and inflammation, remember already, the chest is inflamed, so it is not good to add on to that. And also, people who are asthmatic, most of them have eczema, and this eczema flares up when they have eaten animal protein, especially the processed ones, like the sausages and the smokies and the ham and the like. I used to find that now when you eat that food and your body cannot digest it, and the body gets the eczema, remember the body is inflamed, and already the body has a constrictive chest that is not able to breathe well. So it brings attacks and it triggers. So we need to eat more of plant proteins, and also we also need to eat more of fish and chicken. Fish is good because it has omega-3, which is good for the heart, and it's also good for the chest. We also need to reduce on the fats and the sugars. We need to eat minimal. Our body requires 1 tablespoonful of fat in a day and 1 tablespoonful of sugar in a day. Now you find that if you have respiratory challenges or anyone who is close to you, one thing we need to stop is remove the sugar that we put in our tea, or we reduce it. We need to remove the juices that are from the supermarket. They are very bad triggers. They cause sore throat, they cause that trigger of they cause tonsillitis. It's very bad. We need to avoid the processed foods also, because they have the fats, the trans fats that are not very good, because they are going again to constrict our arteries, and again our heart to beat is a problem. And remember, we have a challenge of people who have respiratory issues, have a challenge of breathing in and out. And again, here we come and we introduce other things. So we need to eat less of that and more of the whole grains. But is that the way we feed? Most of the people I've spoken to, you find that that is not the way we are feeding. Yet we are getting challenges. We have no information of what is causing it. Yet you find that we are feeling, especially if you go to the children's hospital, the clinics are getting full every day. And amazingly, those clinics, they have a vending machine that has a juice there, that has other processed foods there. And you find that it is very detrimental to the health of our children and ourselves, because we are eating the other way around. A lot of fats and sugars, white rice, white ugali, white chapati. We eat a lot of nyama. We are eating a lot of processed foods like sausages, the meat, the smokies and the ham and all that. Then people are eating less of fruits and vegetables and whole grains. We stopped eating whole grains and minimal physical activity. You find that we are becoming lazy every day. And this is today how people are eating. People are eating more of fats and sugars. People are eating the fast foods. They really love the fast food, which is not good for their health. And the soda is very bad. It's very bad for the children, especially. We need to reduce that, because it has, one soda has over 20 spoons of sugar, and it is refined sugar. I was asking myself the other day, and also a salt, and salt is not good for us. Where does these people who manufacture sugar take most or get most of their clients? They come from these companies that process the juice, and do not be told it is natural. The most natural juice that you can get is what you have blended in your house. You have picked a mango, you have picked a melon, you have picked an apple. That is the most natural juice that you can get. So now what happens when we feed this way? These conditions continue to thrive in our bodies, and we should get rid of them. So at Neolife, we came up with a solution. And the first solution is we turn our food pyramid right side up. That is the number one solution that we need to do. We try as much as possible to exercise, to rest, and also to eat the way I've advised that we should eat. Then the other thing is that the company has come up with a solution of the whole of the solution of supplements. And they have a scientific advisory board who checks on the products to make sure that they are good for you and for the environment. And what they do is that they supervise from the farm to the table. So the fruit that we are supposed to eat, we might not get them from the farm, we might not get them from the supermarket or from the market. What they have gone, Neolife has done, it has gone a step further, grown the fruits and the vegetables and the supervised from the farm to the table, and they get the nutrients in their whole nature and in their whole form, and they give us as supplements. And we need to take food like medicine, or we are going to take medicine like food. And what they have done, because we see that we need a lot of whole grains, they have given us TNN. The first work of TNN is to make our cell soft and permeable, such that whatever we eat gets in and waste gets out, and metabolism occurs, and you feel more energetic. That is the number one solution that we get. Now, for people who have allergies, for the people who have food intolerance, for the people who have asthma, one of the things that TNN helps is getting out the sputum. That is number one, because it's able to open up the cell, and the body is able to release that mucus that is not necessary, the sputum in our body. That is number one. Number two is that it is able to give us more energy. You remember we spoke about fatigue. The people who have asthma and respiratory conditions, they are low on energy. TNN is able to give them energy. Number two is that we need to boost our immunity. You find that when you have these conditions, you go to somebody and they have a cough and they have a cold, it triggers and you get it. It easily comes to you. Why? Because immunity is low. So a carotenoid is able to boost our immunity by 37%, especially at a time like now. Our body needs to fight for itself. Remember, we are being told that the best thing that will help us prevent us from getting COVID is carotenoid fruits and vegetables. And carotenoid comes in handy because in 20 days, your body is boosted by 37%. So assume that our immunity was 40%. If you are 37%, you are way over 70%. And this comes from the raw fruits and vegetables. And one bottle of carotenoid complex will give you 100 kgs of raw fruits and vegetables. It is very, very important. Then we need fish. Omega-3 is very good for the heart and the chest. One thing is that it is an anti-inflammatory. You remember we saw that most of the respiratory conditions, there is inflammation. Now, omega-3 is able to remove that inflammation. And Neolife has one of the best, actually, it is the world first because it has all the 8 classes of omega-3. It is pure. You find that fish is a highly contaminated sea animal. It can store lead and mercury. Now, our salmon comes from the cold North Atlantic, and where there is no contamination. So our salmon is very good. Give a baby salmon from the age of 6 months, you find that coughs and colds are things of the past. Then it is also very good for the joints. It's also very good for the heart because it removes away the excess cholesterol that is in our arteries. Omega-3 is very good. And then we need minerals and vitamins. We need vitamin C, we need vitamin B, we need zinc, we need calcium even in our bodies, because you find that these people who have respiratory issues, we say that they are not able to feed very well. So they need a pack that has also minerals and vitamins. And ours is very good because it has over 23 macro and micronutrients. We call it the multi. It is very good. And all that comes in a pack that we call Pro Vitality. Anyone who is over 12 years can take Pro Vitality. My son who is 7 years loves tree, and then I have to hide it because he loves chewing it. Omega-3 is also for children, I'll show you. But we have the minerals and the fruit and vegetables for children that I'm going to show you about. So it is actually very, very good to be able to take this Pro Vitality. Take a sachet a day, and it gives you a whole day food nutrition. Now, well, the best thing about Pro Vitality, apart from the respiratory issues that it is gonna help us in, it's also going to help us in with our blood flow, with managing our sugars. If you have joint issues, it's going to take care of that because omega-3 is very good for the joints. Now, you find that Pro Vitality is very good. And we also have a pack that has the fruits and vegetables because we saw they are key in boosting our immunity, especially at this time. And people who have respiratory issue, one thing they suffer from is low immunity. It has all the fruits and vegetables that are available for us to eat, and it's called phytodefense. It has the carotenoids that I've spoken about. It has the cruciferous that I've spoken that are very important, because remember we spoke about lung cancer and tumors. Now, cruciferous, it is going to crush any tumor or sick cell at an early stage. If you start it early, it's going to crush that cell and reproduce, help the body in reproducing and birthing new cells. So cruciferous is very key. Flavonoid is very good for the watery part of the cell, and it is an anti-inflammatory. So it's going to help the body to reduce being inflamed. And all that comes with a phytodefense. It's very, very, very good. And then the other product that is very important for people who have respiratory issues is herbal respiratory. Herbal respiratory is a herbal product that clears the airways. Remember, we spoke about the airways are not clear. It is made of herbs and it helps to clear the airways. Now, I gave my daughter herbal respiratory. She was 8 months. I used to crush it. I told myself, the way we hold our kids' noses and we put through medication, I'm also going to give her this alongside doctor's medication. So if you have respiratory issues and you're seeing a doctor, you have doctor medication, please do not stop. Supplements are to help the medication work better and help your body in fighting the condition that is affecting. So herbal respiratory is good for all ages, people who have especially respiratory issues. Now, if someone has COVID, it's very, very key they get herbal respiratory because it's going to help clear the airways. If somebody has asthma, bronchitis, it's very good that they get herbal respiratory. It's a very good product. The other product that is very important is Neolife Shake or the Nutri Shake. I'll show you the Nutri Shake. Now, remember we spoke about the allergies. Remember we spoke about the eczema because of the proteins and some foods are not to be able to be metabolized. Now, Neolife Shake has the 22 amino acids that helps the body produce the antibodies to metabolize the proteins that are not able to be digested. It's very good for the gut. Gut is our second brain. So we need to have a healthy gut that is able to help our body to metabolize and to digest all these things. So Neolife Shake is very important. Also remember we spoke about appetite and they are not able to eat very well. Now Neolife Shake will give them a complete meal that the body requires. Because remember our body needs to reproduce new cells that are helping our body fight. So Neolife Shake is very, very important. It's going to help remove all those allergies. If somebody has eczema, they must take Neolife Shake. Then we have zinc and we have garlic. They're very good to boost the immunity. Garlic is an antibiotic. I also remember I used to crush for my daughter the garlic. It's an antibiotic. And this garlic is also a very good immune booster and it has no after smell. I know most of us fear to chew or take garlic because of the smell that comes with it after that. Garlic has no after smell. It's very good. Zinc is also very good to boost the immunity. We have seen with COVID, somebody with zinc, and they take zinc, we are told to take zinc every day. People who are admitted, they're infused with zinc and vitamin C. It's very good. Zinc is also very good to boost our immunity. It comes with other health benefits. Somebody who has wounds, it's able to help to heal wounds. It also comes with other benefits. Helps the body to produce insulin. So people who are diabetic, it's very good. It's also very good for the prostate health. Zinc is good. Then for the kids, we have the fruit and the vegetables that comes with the Liquivite that has also minerals and the VitaGuard. The carotenoid for the children is the VitaGuard. It has fruit and vegetables. They are baby flexible. They can be able to chew. They are friendly to the babies. They come like sweets. They have no sugar. They are packed with fructose and natural flavors. VitaGuard is very good. We have Vita Squares that has the Trianen for the children, and it also has the minerals and the vitamins. Remember the Provitality. Now these two are able to give the children the Provitality. For the children who are under 2 years, they can be able to chew. They get the Liquivite. It's a liquid form. It's very, very good. Also for people who are old and invalids, who are not able to eat very well, they have been sick for a long time, Liquivite is very, very good for them. Then we have the vitamin C. Vitamin C is really helping, especially these times, because it has collagen. It is not helping. It is making that virus, the coronavirus, not to be able to thrive in our body. We have the chewable. See, they are currently out of stock. It comes. Talk to the person who has invited you here. They can tell you when we have it available on stock. Take it and grab it. And we have also the vitamin C SR. The difference is that one, the SR, we call it sustained release, takes 6 to 8 hours to be released in our bodies. So you take 2 tablets or 1 tablet a day. The All C comes with oranges. It is a chewable vitamin. And every 4 or 5 hours, we take this. And then we have the NutriShake. They come in flavors. These are for people who are young, people who are old, and they also do not have excess sugar. Is very, very, very good for them. I used to put it in milk. So vanilla for the young babies is very nice. That won't be noticed. And or the bigger ones, give them the strawberry. And I got my daughter out of that condition. And she regained her appetite. Today, if you see her, she's giving me good competition. One of these days, you will see her. She's a good presenter and an advocate of this product. And then we have a targeted solution. We have for the joints, we have for the digestive, we have for the stress management, we have for men's health and women's health, and we have for digestive health, energy, and fitness. But because of time, I'll not go much into the details. In case you have a question you'd like me to answer, you can type in the chat box, or you can ask the person who has invited you. Right now, I just want to call one person who has been able to use these products, and I met him online on Saturday when he was giving his story, and I was amazed. So this is somebody I've not met personally. We are with him here in the company, and he's very excited, and he has used the products. He's going to share to us. He's Herbert Nabangi, and he has used the product. He's going to give us his story of how the products have been able to help him, and you are going to pick 1 or 2 things that will be able to help us. So Herbert, if you can hear me, please proceed and tell this great audience what these products have done in your life.
Thank you, Lydia. I hope you are hearing me.
Yes, we are hearing you.
Thank you very much. As Lydia has said, my name is Herbert Nabangi. I'll talk briefly about myself first, my marital status and family. I am married to one wife, my first love, a great lady called Jacinda Nabanki, who is next to me. I don't know, let's see whether you can see us properly. I think that light is better now. Together, God has blessed us with 7 great people, 3 lovely ladies, and 4 strong men, plus 5 angelic grandchildren. I'm now 61 years, retired soldier, after close to 40 years of colorful service as a telecommunications engineer with the armed forces, of course, military. I was with the Kenya Army. So what was I doing before Neo Life? When I retired about 2.5 years ago, I took up a part-time assignment with Strathmore University to moderate in family development courses. I'm therefore moderator with a program for family development at the Strathmore University. So what attracted me to Neo Life? It is the products that I needed for gastritis, which is as a result of too much gas produced in the stomach due to acidic conditions, which I had suffered for long, which is very discomforting and painful and stressful at the same time. So my wife had been using some supplements to manage her pressure, and she was getting better by the day. It made me think of the products as well. So I started with Profitality, Phytodefense, Aloe Vera Plus, Neo Life Shake, and a few others like zinc and vitamin C. As Lydia has told us, I just mixed them all. So we decided to join so that we could save money as we buy to use and also do real business and make money by sharing the opportunity and the products with God's people. Now, which benefits have I received so far? This is the most important part. When we joined in June this year, we joined, as I said, by using and sharing. But shortly after, I contracted COVID in mid-June, July. And it was devastating, to say the least. I saw death, but while I was at the famous boundary, the boundary between death and life. When you are watching, I was just watching what was happening on the other side of life. I had not even given up. As I was being admitted to the famous isolation ward, my strong, caring, and daring wife took Neo Life supplements, Provitality, Phytodefense sachets, just those 2. And I think also vitamin C was there. Took the sachets and stashed them in my jacket and said, please, it is not over yet. Take both of them at least once daily. Kindly take them for me and do not let anyone see the supplements. Of course, I had lost hope, but her facial expression was serious, yet full of hope. My mind had already suffered serious damage, but I remembered my wife's instructions. I followed strictly. I remained on tight observation, on oxygen the whole day. I had taken 2 days to be admitted. Of course, that time there were no hospitals ready to admit anybody. They are saying everywhere isolation wards were full. Like enough, when we found, after 2 days, we found one hospital. And as I said, I was on oxygen. Wherever I was going to hospital, they would put me on oxygen because they saw I was desperate for air. So this time I was admitted and I remained on oxygen 1 day. And by the following day, my immunity had taken control to stabilize the oxygen levels. So much that the doctor commended to the nurse that other patients need oxygen more than me. And my oxygen gadgets were taken away. On the third day, my COVID status was confirmed. It took quite long to confirm. So I was moved into the COVID ward. And my only hope evaporated when the nurse told my wife that she could not follow me into the COVID ward and that she won't see me again until I finally leave the ward dead or, if lucky, alive. This was a huge statement that landed on my brain like a bomb. It sent cold chills all over my body. All those in COVID ward were on ventilators. And therefore I concluded that my oxygen had been removed in order to kill me. My mind was running uncontrollably down. It was my lowest moment ever. But because of time and to cut the story short, I was miraculously released after 5 days in hospital in a relatively stable state to self-isolate for the remaining days, partly to create room for others who are desperate. The point is that God healed me, but Neolife products played a very important part in my quick recovery. Now, for the 5 days in hospital, the bill was almost 300,000 shillings, Kenya money. The supplements boosted my immunity and shortened my hospitalization and saved my family a much bigger bill. I therefore can confidently say that spending 20,000 Kenya shillings on Neolife products a month cannot be compared at all to all hospital bills. So it is wise for anybody to choose these great health supplements instead and be healthy than struggle with bills in hospitals. How do I see my future with Neolife? Our future is promising. We are now headed to directorship. It is the business of now and the future. That's our summary. That's what we can see. Advice to our guests who are here. I wish to encourage you to join this opportunity. If you are not ready to join now, then make sure you become customers so that at least you benefit from the super organic products. Benefits are unrivaled. It is double benefit for those who join the opportunity, i.e., you'll get the money and benefit from the great products. Allow me now to hand this call back to our leader, Lydia. Lydia, please take it away. Thank you.
Wow, wow. Thank you very much, Herbert. It's a pleasure, it's an honor for coming and being vulnerable to share your health benefits. Not many people would declare they had COVID, and you're coming to openly tell us about that situation and how you overcame it. We are really grateful and we thank God for you. And yes, you're building the business like no other is a business for now. And from the things that you're doing, you can see that you're on your way to director. For the guests and the people who are here, please make sure that grab the best investment that you can give yourself, which is health. And a supplement is a health insurance. That's what I always say. I know we invest a lot in other things, myself included, in the cars, in the clothes, in the houses, and we hardly invest in ourselves. We forget. Sometimes it's our nature. But let me tell you, the best gift that we can give ourselves is we grab the products, we take them for ourselves and for people that we care and love, and we share with them the products. As Herbert has said, is that we need, you can get started, use the product, or you can be able to get them from the person who has invited you here, and they are going to show you how you can get started. I really
Did we lose you, Lydia?
sorry. They are able to show you other products that we have, and also an opportunity that can help you travel like I've done. I've been to South Africa, I've been to the UK. Remember, I joined not caring much about the business. I never even thought that health was important, but I've been able to enjoy a lot. I've also been able to grow as a person, being around a network of people who have the same mission of empowering others and changing the world and making the world a healthier and a happier place. We really thank you for tuning in. Thank you very much. Good night and God bless you.